Shaylee is a 17-year-old single mom who was 8 weeks postpartum. She dropped out of high school and quit her part-time job in order to take care of her son, and is currently experiencing a lack of support and showing signs of postpartum depression. Today, the community health nurse is visiting Shaylee after receiving a phone call from the client's mother, expressing concern about her daughter's affect and behavior.
Thank you for having me in your home today, Shaylee. My name is Carolyn. I'm a registered nurse that visits new moms like yourself just to check in and see how things are going. So, how are you doing?
I'm doing okay, but I guess I just feel like I'm doing this all alone. You know, my friends, I don't really have much contact with them anymore since I've had the baby, and Joey's dad is completely out of the picture, and my mom, she's always so busy working to support Joey and I, so I feel like I'm doing this all alone, and that honestly anyone can be a better mom to Joey than me.
Thank you for sharing that with me, Shaylee. Those are not easy feelings to express, but it's important that you do talk about them. You need to know that Joey is doing great. You're doing so well at meeting all of his needs, and he's growing wonderfully.
Thank you for saying that. It's great to get some reassurance that I am being a good mother to Joey.
Of course, of course. Healthy babies need parents who take care of themselves and provide an environment for them to grow and thrive in, as this is important for their social and cognitive development. From what you've shared with me, I have some concerns with how you're coping. This is a major life transition. I have a questionnaire that we use with all new moms. It's called the Edinburgh Postpartum Depression Scale. Would you take a few minutes to fill this out, please?
Sure.
The Edinburgh Postpartum Depression Scale is a set of 10 screening questions that can indicate whether a parent is exhibiting symptoms common to postpartum depression. Each question has numerical values attached to the answers, which are tallied at the end. If the added total equals 10 points or more, it is suggestive that the respondent could be at risk for postpartum depression. Please note that this is not a diagnostic tool and should be done with a healthcare professional.
Thank you for completing that. It's not within my scope of practice to diagnose postpartum depression, so I will pass this on to your family doctor. But I would like to discuss some of the responses. Like number 6, things have been getting on top of me. You answered, yes, most of the time. I haven't been able to cope at all. Can you tell me a little bit more about that?
Well, I guess I put that answer down just because I feel like I'm doing this all alone. I feel like I'm not being a good mother, and I don't know what to do. I think I need help.
Okay, I can help with that.
A genogram is a graphic representation of a family tree that displays detailed data on relationships among individuals. They allow healthcare professionals to quickly identify and understand various patterns in the patient's family history, which may have an influence on the patient's current state of health.
Based on unique client preferences and needs, a registered nurse can encourage the implementation of a multifaceted approach, like facilitating connections with local support groups such as the Louise Dean School and the Highbanks Society, which focus on building capacity for adolescent mothers, education surrounding sleeping when baby sleeps, exercise, a balanced diet, and regular visits to the family doctor.
As nurses, we strive to provide client-centered care. What that means is care that is completely centered and catered around you and your individual needs. We also want to have our care be realistic and achievable. Do you think that the things we've talked about today are doable?
I do. You've given me a lot of good strategies to try to implement in my life, but I think if I try a few at a time, then I can really do this.
Perfect. Good. Do you have any questions or concerns?
Not that I can think about at this time.
Yeah, sure. I'm going to leave you with my card. If anything comes up, any questions that you have, please don't hesitate to give me a call. Let's book a follow-up appointment for a couple of weeks from now, and we can get together and evaluate and reassess the effectiveness of these things that we've talked about.
Great. Thank you very much.
Thank you.